Welcome back everyone to another video of nclexcrew. In this video, we are going to talk about a very important topic, that is critical thinking versus content knowledge. Both are super important. I'm not denying that, but the point is critical thinking is the must you have to learn. It doesn't develop overnight. It comes when you practice more and more question and think more critically whenever you are attempting a question, how you deal the question. Sometimes even if you don't know the answer, if you think critically, you get the right answer. So let's move on. There are 5 key factors in any question that you have to look for before you move on the answers. So number 1 is client. You have to look for who's the client, who's the patient. Is a male, she's a female, what's his age. These are a few things you have to look for. Number 2 is the problem. What is the chief complaints? What is the diagnosis? Number 3 is subjective or objective data. So subjective data is something that the client or the patient tells you by himself or herself, and the objective data is something that you have to assess as being a nurse on your own. That's the objective data that you are collecting from the patient. Number 4 is the keywords. There might be a few keywords that might help you in finding out the correct answer. So number 5 is the content or priority based question. You have to identify before answering the question, is it a content based question? Does it testing you on the knowledge? Or you have to prioritize which client you are going to see first. So there's also different techniques to identify the question that I will be sharing in another video. For now, just remember you have to identify this first. So let's move on to the question. Number 1, uh 67-year-old male client comes to the emergency department complaining of chest pain. He tells the staff that he had a spicy pizza for the lunch this afternoon. What is the first action of the nurse? So quickly find out the keywords here. 67-year-old, that is a client. Then chief complaint is chest pain. Spicy pizza he had, that's the subjective data he tells to the nurse. Then there is no objective data, we have to do assessment, right? So before we move to the answer, we have to look for these 5 key factors, whatever I told you before. So these are the following options. Number 1, discharge the client as he said he had pizza. I will cancel it because I'm not discharging any client before doing anything, right? I'll leave the number 2. Give 2 liter of oxygen for breathing problem. No, I can't do that. There is no indication that he is having breathing problem. Number 4, give nitroglycerin stat. There is no indication that he is having heart attack. So as per my assessment, I would say I have to assess the client before doing anything else. There's a golden rule. You have to assess until in distress. Keep this in your mind. So out of all the 4 options given in the question, I would select answer number 2 based on my assessment, my knowledge. Let's move to the answer. So the correct answer will be assess the client. That's what I told you. But every answer, you might pick it right or wrong. You have to know why is it correct. So for this, I will explain. That's what I told you before. You have to assess before doing any implementation. As per all the 3 different options, there is no indication that he is having any of the such problems. So we have to do assessment. We have to find out what's going on with the client or the patient before we do anything else. So the correct answer will be assess the client. Next question is here. A nurse is called in for on-call shift in emergency department and quickly trying to prioritize the client. So there is a specific word here that says prioritize. It means it is a priority based question. You have to select one option that you need to do first of all the other 4 clients. Read out the answers. Yellow ear drainage and history of eustachian tube cancer, new onset confusion and staring up at right, wall and arm pain with obvious deformation and capillary review 2 seconds. If I read all of them, I feel like there is number 1 patient is stable, number 3 is having pain, but I don't think it's an emergency. Next, move to the 4th option, a typical migraine that is untreated with home medication. He's a migraine was not treated, but it doesn't seem to be the emergency here. So as per my knowledge, I would say the right answer is number 2. One more thing to keep in mind, whenever there is a change in the condition from higher level to the lower level, You have to select that answer. Rest of the three options were stable, known emergency, but this one there's a change in the condition. So this will be the right answer for this question. If you have any further question regarding this question or any of them, please put them down in the comment section. I will be happy to help. And then thanks for watching. I'll see you in the another video with such more information content. Thank you.